Hi everyone, I'm Dr. Shimi Kang. Thank you so much for joining me today on my channel, Mental Wealth with Dr. Shimi Kang. Today we are going to talk about substance use, alcohol, drug use, nicotine, other substances. This is such an important topic. Around 80% of the population uses substances and 20% will get in trouble with substances like alcohol, drugs, or nicotine. I'm going to use the story of Prince Harry today to explain our relationship with substances. Now, Prince Harry, I must say, is so brave and courageous in sharing his personal story. What he said happened in his 20s and early 30s when he used alcohol and drugs to deal with feelings of depression and grief and anger in relation to how his mother died, and all of the feelings around that. Now, obviously, you can be a prince with access and all the money and resources in the world and still really experience the suffering of mental health issues. And I'm so grateful that he shared his story. It is so important for people to know that these can affect everyone. Everyone is at risk. No one is immune. Substance use affects, like I said, 20% of the population. That's 1 in 5 people will have a diagnosable disorder in connection with things like alcohol or drugs, or behaviors like gambling, pornography, shopping, social media. So addictive behaviors are a really important part of something that we all need to understand, whether it's affecting ourselves or someone we love. This is part of the human experience, our relationship with things like sugar or alcohol or nicotine or social media. We really need to understand the science behind how these things affect our body and minds, what to do if we find ourselves in trouble, how to know when we're getting into trouble, and of course the solutions. The solutions are in us. This is the science of who we are. So thank you so much for joining me. This is a topic I am so passionate about. I'm an addiction psychiatrist. Actually, that's my background. I spent most of my professional life studying deeply the science of addiction and substance use and how it impacts our body and mind. What are the risk factors? How do we know? How can we get help? Thank you so much. Let's get started. So Prince Harry lost his mother when he was just 12 years old. He's reported to say that her death wasn't discussed very much. That makes me wonder if he got any help with coping with the grief and loss of his mother's death. Now, it's really important to remember that we go through stages of grief and loss. First, it's something called shock or denial, and that's very common. We don't even believe that something like this could have happened, or we deny it, and that's a protective mechanism in our brain. Then there can be something like anger, and that anger could be to yourself. You know, maybe as a child, you wish you were nicer to your mom or said something that you didn't say, or anger towards others, maybe the paparazzi in the situation, or the people or the driver that was involved. So anger is a normal part of grief and trauma and loss. And then the next stage is depression, where the mind can go into a dark place, feeling really withdrawn, feeling like you don't want to see people. Depression is a medical diagnosis, or it could just also be a depressed mood and not knowing how to cope. Finally, there's something called acceptance. I believe if Prince Harry was given help with coping skills, skills that we can use, things that we can do when we're feeling the stress of loss, and when we are triggered into that freeze, fight, or flight response of stress. I talk a lot about that in my mental health videos, my mental wealth videos. You can click on it here and learn about how stress impacts our brain. You can click here to find out how coping skills can be developed and mastered. They're really important for everyone, especially kids. In my programs called Dolphin Kids, we teach young people as young as 3 years old how to cope with stress, how to manage their 3 brains, how to use coping skills like play, a connection with each other, and downtime or self-care to really get us out of these experiences, out of stress response, and into a place of growth and wellness. For Prince Harry, drug and alcohol use is really about flight, okay? So the stress response makes us freeze, so that's a deer in headlights, fight, like a tiger roaring, or flight, escape, like a bird flying away or running away. That's the flight response, mental escape. And we use things like sugar and eating and alcohol and drugs and video gaming or pornography or social media or whatever distraction to mentally escape. So Prince Harry said in his late 20s and early 30s, he used any kind of drug, or he said he used alcohol particularly to really deal with these feelings, this trauma, this emotional unrest that he was experiencing. A lot of people self-medicate mental health symptoms with substances. There's a strong correlation between mental health issues and substance use. In fact, almost 78% of all addictions have an underlying untreated mental health condition. So in my life as a psychiatrist, I've worked with thousands of people, tens of thousands of people from all walks of life, and my audiences as well. And I realize, and what the science says is that when we don't treat mental health conditions, when we ignore them, when we don't discuss them, then people find ways to cope, unhealthy ways to cope, of which drugs and alcohol and substances or addictive behaviors like gambling, pornography, sex, social media, like I said, can all become part of a second illness, a second condition. That's what we call concurrent disorders. So this is where mental health and substance use or addictive behaviors run together. They feed off of each other. They're intertwined. This is a complex area of medicine called concurrent disorders. It's really important to understand because we don't want to divide it up because they are really influencing each other. They're impacting each other. So Prince Harry said that he used alcohol and drugs to cope with the anger, the grief, the sadness of what happened to his mother. And let's understand that relationship between substance use and our emotions. Prince Harry said that he also experienced severe panic attacks and anxiety as an adult. And that also is related to the grief and loss that he experienced as a child and not having other ways to cope with that grief and loss or trauma. He turned to alcohol and drugs, and then sometimes his body would just take over. That amygdala, that stress response would fire, and he would experience a rush of adrenaline. That adrenaline can lead to what's called a panic attack. Panic attack is when your heart is racing, you're shaky, you're sweaty, you might feel out of control, you might experience numbness or tingling in your extremities. It can feel like you're going to die or have a heart attack. My patients tell me that they feel that they could even go crazy. It's a horrible experience, a panic attack, if you've ever had one. And Prince Harry is so brave and talking about his, but these are all common experiences that can happen, especially when we've experienced loss or trauma in childhood. That experience triggers that deep part of our brain, that amygdala down here, that stress response, where we move into a place of reactivity, of fight, flight, or freeze, and we move out of that neocortex, that top part of our brain, that important part of our brain that doesn't react but interacts with the world around us, where information comes in, data comes in, we process it, and then we make a choice. So right now, it's so wonderful to see Prince Harry. He's moved from that reactive part of his brain where he's freezing, getting anxious and panicky, fighting and getting irritable and angry, and flighting using alcohol or drugs. He's now interacting. He's bringing all that experience that he had And he's making choices to speak out, to educate, to build awareness, to speak with compassion and purpose. So here's an example of how amazing our brain is, our human experience. We are all in this together, whether you're a prince or a commoner or anybody on this planet. We all have emotions. We all have stress. Stress is the #1 health epidemic. We want to move, like Prince Harry did, from being really reactive when he didn't understand, when he didn't have the skills when he was younger, and was stuck in anxiety, irritability, and distraction or substance use, to a place where he is now of choices, the neocortex, making decisions, advocating, speaking out, and really being a leader in this really important topic of mental health and well-being. Now that we understand a little bit about how substance use can happen to people from all walks of life, nobody is immune to this. It's actually very common to get in trouble with alcohol and drugs and behaviors as well. Let's understand some science-based solutions. The first solution is prevention. You want to really reduce your risk of getting into trouble with alcohol, drugs, or addictive behaviors. One way is to know yourself, I say, is understand who you are and what your unique risk factors are. Some common risk factors for addiction are a family history of addiction. That would be any blood relative that also might have any addiction. It could be nicotine, it could be alcohol, it could be behaviors like gambling or shopping. So that's the first clue. Other risk factors include what's called comorbid or other mental health conditions that might be running as well in conjunction with possible addiction. So if there's family history of anxiety, depression, or personal history of anxiety, depression, ADHD, or any mental health issue, that puts anyone at risk of substance use because of that self-medication I mentioned. Now, Prince Harry talked about anxiety and panic attacks, and that connection could certainly have been part of driving his alcohol and drug use at that time. Other risk factors could be biological, meaning any history of head injuries or physical health problems, especially chronic pain can be a risk because if someone has chronic pain, they're more prone to using pain medications, many of which, including the entire opioid class, are highly addictive. I have chronic pain. I live with a genetic condition where my body doesn't make collagen, and I avoided opioids. I really did because I am an addiction psychiatrist. I know how powerful and addictive they can be. So chronic pain or injuries or even surgeries can tip people towards addiction. And there's a class of medications called benzodiazepines, so Ativans and clonazepam and Valiums. These are highly addictive. They're very commonly used, sadly. You really want to be very careful, and in fact, I recommend just staying away from them. Other risk factors include trauma, grief, and loss, like Prince Harry's story. When we've had emotional experiences that we haven't processed or discussed, that can really put us at risk. I have a video where I go through Lady Gaga's story of trauma. In her case, it was sexual assault, and really go deep into how trauma can impact our mind and body. And if you want to watch that, please have a click here. So if you are getting in trouble with drugs and alcohol and you weren't able to prevent it, you want what's called early intervention. So you want to intervene early. You don't want it to go on and on for years, because what happens when we have a certain behavior, it can become a habit and it can be harder to control. So you want to really get help early and try to control that behaviors as soon as possible. The longer it goes on for, the more risk you are of it getting more serious, harder to treat, and also developing secondary complications like anxiety or depression. So ways that people overcome substance use behaviors or addictive behaviors. So it's not so easy to just stop, right? Or just say no. If that was the case, people wouldn't get in trouble in the first place. So you want to get help. And what we know and what's scientifically proven is having a group can be very helpful. That's the premise of things like AA and Smart Recovery, or even Weight Watchers. Having a community that's supporting you, a sponsor or a friend, or just a a buddy, a running buddy, any behavioral change we know is very effective when it's done in a group format. Other treatments can be really barring yourself from the problem behavior. I've worked with many gamblers over the years who bar themselves from casinos, or people who are addicted to pornography who bar themselves from websites. People with alcohol drug use delete the phone numbers of their dealers, or really avoid driving by the alcohol liquor store. They're creating an environment where they are blocking access. That's a key first step in recovery and healing. And also some people, and many of my patients, that we arrange what's called urine drug screens. So they know that if they're going to get caught, it will help them make better choices. So a lot of my patients, we have random urine drug screens where they know that at least I'm going to find out. That becomes therapeutic. It's not punishment. We're doing it to help them pay attention to this behavior. And I often say to them, look, it's not that I don't trust you, I don't trust the addiction, this really powerful thing. So that is also some really good ideas. Of course, there is intensive professional treatment. I see that all the time. I have so many patients over my career that I've helped move away from alcohol, marijuana, cocaine, opioids, prescription benzodiazepines, behaviors like gambling, shopping, eating. And it does take work, but you want to find a therapist that you trust. The fit is really important. If you don't trust someone and you don't like someone, it's pretty hard to learn from someone. It's kind of like a teacher. So you want to find a doctor, a therapist that you trust, and that is helpful. One of my pet peeves are sometimes people go to therapy and they go for like a year, and then when I say, what did you learn? What did you guys talk about? They can't tell me anything. And I'm like, you didn't talk about how to quit smoking, or how to prevent relapse, or what your triggers are, or what else you could do, or what are your coping skills? And they said, we just talked about a lot of stuff, but they couldn't identify anything. So you really want specific therapy, relapse prevention, and identification of your unique triggers, your unique relationship, and building in alternative strategies, really a cognitive, it's like doing homework, understanding yourself and your relationship. That kind of therapy can work really well. Look for therapists trained in motivational interviewing or motivational therapy. That's what I'm trained in. I find it is so effective. It's got very good evidence for helping people move from what we call a state of change of denial or pre-contemplation to contemplation, where they want to get help, but there's a reason they're connected to that behavior, to action, where they're actually getting the help and maintaining it. So that's maintenance. So they're staying healthy and preventing relapse. So it's a really specific type of therapy. So ask your therapist or counselor if they are trained in motivational therapy. That's really helpful. Other forms are cognitive behavioral therapy. I think that Prince Harry may have experienced that. He does talk about getting help. Cognitive behavioral therapy looks at our thought patterns and our behavior patterns and identifies places that we would say are negative thinking habits, and helps us monitor and scan that and bring in new habits with the help of a guide or teacher. Really effective. Other therapies are stress reduction or mindfulness-based therapies, regulating our biology, right? Breathing and mindfulness, and just giving ourselves an understanding of the mind and body, and bringing in those emotional regulation tools. I have prescribed medications to a lot of people with substance use, and I look for underlying mental health conditions. It could be an antidepressant I prescribe, or a sleep medication, or an ADHD medication. All of those could be helpful. And of course, there's something called residential rehabilitation. People who might need to go in and completely change their environment to deal with substances, to get away from the triggers, to really be in a place, ideally very holistically, where you're working on your body, you're working on your mind, you're working on your family and friendships. Sometimes those places can be very helpful, and those are called recovery centers. And also, we can't forget really important spiritual help. We know people who are connected to something beyond themselves, who have a belief in something greater than themselves, also show better recovery from drug and alcohol use and trauma. So if that's part of your life experience, then you want to tap into it because it's very powerful. The other thing that people do that is very healing and helpful is advocacy and helping others and activism. That's exactly what Prince Harry is doing right now. He is sharing his story of when he used alcohol and drugs to cope with negative emotions, when he had anxiety and panic attack, by helping others, sharing your story. And sometimes you're not ready, and that's fine, but just helping the world in any way. You get what's called a helper's high. That's a hit of dopamine. That's what we're all looking for. People are looking for in these addictive things anyway. We actually get it when we help each other. We are social beings, and you can get your dopamine that way. And you also get some other wonderful neurochemicals, things like oxytocin and serotonin when you're creatively helping. So being part of your community, being an advocate, being an activist, or just being a contributor are very helpful to overcome any difficulty in life and to enhance our health and our own personal wellness. I'm so grateful that you joined me today on this episode of Mental Wealth with Dr. Shimi Kang. I hope you gained more understanding, more empathy, more awareness, more knowledge. Knowledge is power, and empowerment around the topic of substance use and coping and grief and loss. Thank you so much, Prince Harry, for sharing your powerful story of what happened to you when you were just 12 years old, your journey through grief and loss and anger and sadness and all of that, and how it impacted you, led to alcohol, drug use, led to anxiety, panic attacks. By sharing your story, you have told so many people they are not alone. 1 in 4 people on the planet experience mental health issues. We all experience stress. So please take the time to invest in your most powerful asset. Join me here on my channel, Mental Wealth. We talk about so many things. We talk about the neuroscience of who we are, the science of what leads to health, happiness, and success. So I hope to see you. Don't forget to subscribe. Leave your comments below, and I'll see you next time.